47-year-old man presents with gradual loss of voice and difficulty swallowing both solids and liquids for the past couple of months. His medical history is insignificant except for occasional mild headache. Physical examination reveals loss of taste sensation on the posterior third of his tongue and palate, weakness in shrugging his shoulder, an absent gag reflex, and deviation of the uvula away from the midline. MRI reveals a meningioma, which is compressing some cranial nerves leaving the skull. Which of the following openings in the skull transmits the affected cranial nerves? The options are foramen spinosum, foramen lacerum, jugular foramen, foramen ovale, and foramen rotunda. All right, so next question is a 47-year-old man presenting with gradual loss of voice and difficulty swallowing both solids and liquids. Okay, difficulty swallowing one thing at a time, right? Insignificant, medical history is insignificant except for occasional mild headaches. Physical exam, so patient is also having loss of taste, difficulty swallowing, there is loss of taste on the posterior third of the tongue and palate, weakness in shrugging the shoulder, absent gag reflex, and deviation of the uvula. First of all, tell me what are the cranial nerves being involved in this patient. I think they've already told us all the signs that they can to tell us what cranial nerves are involved, right? And yes, it's 9, 10, and 11, right? 9 is what? Let's review some cranial nerves anatomy. Glossopharyngeal, great. It can because of glossopharyngeal, you have loss of taste sensation on the posterior third of the tongue and palate. Okay. 10 is vagus. Vagus involvement is what is causing difficulty swallowing both liquid and solids, loss of voice, right? And because of 9 and 10 both being involved, patient has an absent gag reflex. 10 also causes deviation of the uvula away from the midline. Okay, and 11 the accessory nerve, right? And that's what is causing the shrugging of the shoulder, weakness in shrugging, because it supplies your trapezius and your sternocleidomastoid muscle, mainly trapezius, right? It's the spinal accessory nerve. And the question is, they transit the skull, that means they leave the skull through which foramen? Okay, and this patient is having a meningioma, which is a tumor of the meninges. It is compressing the cranial nerve. It is compressing this foramen that contains these three nerves, and that's why the patient is having these symptoms. Okay, so 9, 10, and 11 leaves the skull through jugular foramen. Have you heard of middle meningeal artery? So the middle meningeal artery is what enters the skull through foramen spinosum, and it is involved in epidural hematoma. Okay, so when you break the steryon, what we call the junction of the cranium, the skull bones, that's right there we call the terion, and that is the weakest portion. When somebody gets hit over there, they can get a bleeding from middle meningeal artery and can have epidural hematoma. And that middle meningeal artery is what is passing through the foramen spinosum. Which nerve passes through jugular foramen? It's 9, 10, and 11. Cranial nerve 9, 10, 11. Glossopharyngeal, vagus, and spinal accessory nerve. Okay. So next is foramen lacerum. Foramen lacerum, it doesn't transmit anything basically, but there are certain structure that overlies or that passes through it, not through it, but just overlies it, right? Things like internal carotid artery and its sympathetic plexus that kind of covers the internal carotid artery, just like overlies that foramen. Nothing goes through foramen lacerum. Okay. Foramen ovale, it transmits the mandibular division of trigeminal nerve. Okay. Ovale transmits mandibular division of trigeminal nerve. And rotundum is the maxillary division of trigeminal nerve. Okay, maxillary division of trigeminal nerve. I'm just going over the questions again. So cranial nerve 8 is going to go through internal acoustic meatus. 7 and 8 is internal acoustic meatus. Cochlear nerve passes through ovale. No, it's the mandibular branch of trigeminal nerve that passes through ovale. Maxillary division of trigeminal nerve passes through rotundum. Okay. And the ophthalmic division along with 3, 4, and 6 passes through the orbital fissure, the superior orbital fissure.
Thanks for watching. Please give a thumbs up and subscribe for more.